Hello, this is the lab prep for sterile asepsis. In this lab we'll be covering sterile fields and urinary catheterizations. The prep for this lab consists of several Mosby's videos. We have some readings. You'll be practicing sterile gloving at home, which I'll talk a little bit more about in a minute. And please review and understand sterile technique prior to coming to lab. Back to the first lab that we had, we discussed medical and surgical asepsis. Medical asepsis is clean technique. Surgical asepsis is sterile, and that's what we'll be doing in this lab. Sterile means that you have an absence of microorganisms, and we do our best to do that when we use our sterile technique. And skin, no matter what we do with it, isn't going to be sterile, but we can do our best, say, is in the OR with cleaning and different solutions and that sort of stuff, but skin itself is not sterile. You need to create a sterile field using sterile equipment, and we'll be doing that. And when I say that, you're responsible for this, nobody else. And this is why you really need to understand what you're doing. You're the one that's going to make or break this. And examples of some sterile procedures: surgery, of course, some diagnostic procedures like a cardiac cath. What we'll be doing is urinary catheter insertion. So these are some samples. And when you use equipment, you have to verify the sterility. You need to look at expiration dates. You want to see if the wrapping is secure, if there's any holes, rips, tears, that sort of thing. Throw it out, don't use it. And there's different ways that you sterilize with heat or chemicals. If there is any type of non-sterile object that has touched something in the package, throw it out too. And also check for dryness. Is the package wet? If it is, you need to start again. Principles of sterile technique: all objects used in a sterile field have to be that way. So in example here, this is a drape similar to what you'll be using in lab, and what I've done here is the top side of this is sterile once it's opened up, and there's a specific way to open, which we'll do. And I've drawn a red frame within the edges of this drape, and that depicts a 1 inch margin all the way around. And where you put all the sterile items is within that 1 inch margin, not out here, because this is considered non-sterile. You can use this to move it, but you have to. And this red is schematic. You will not see this on a drape, okay? But this one, I wanted to give you an idea of what it is when we talk about the 1 inch field around it. When you're working with a sterile field, make sure you're not coughing, talking, sneezing over the field. I think that kind of makes sense. You reach around, not over the field. Things that, because something could drop off, dust could drop off your arm, whatever. And remember that anything below the waist is considered contaminated. If you turn your back on the field, it is considered contaminated, okay? You take your eyes off, that's all there is. And I'm not talking within the OR here. I'm talking within a procedure that you're doing. And only if you do have a sterile gown on, only the front part is considered sterile. So below the waist, you have that 1 inch margin. You reach around, not over, and certainly keep your hair back and jewelry to a minimum, that sort of thing. We don't want anything falling into this field. You know about the edges. You know how about to move by using the edges, or you can go underneath the field to move. And you can also use sterile gloves or forceps to move things around in the field, which we will practice. A wet field is not sterile if there is strike through from the other side. So if you drop something onto the sterile field, unless it has a barrier, a moisture barrier, if it goes straight through and onto whatever surface that you're working on, that is now not sterile. You need to throw it out, because, as you know, microorganisms move very quickly through fluid. Gloving, you need to wear for procedures that require sterility, but you don't necessarily have full surgical attire, such as the hat and the gown and that sort of thing. You can get what you do is you wear gloves, and you can create a sterile field with that. But you need to understand the principles of sterility, what we've been going through, in order to do this. So if you have to say, is that sterile or not? If you ask that question, it is not sterile. There is no question. Okay, there could be dire consequences here if there is a break and you don't identify it, or you let it go. So we really cannot let it go. This is a very, very important part of what you do. You must identify those breaks. We'll work in a team, so it does take practice, and we will be looking at each other and watching each other to identify. And this is the time to learn. Got some pictures here for you to take a look at. Woman on the right's got her sterile glove in her hair. That's not too good. And on the lower right-hand side, not putting on those gloves correctly, are they? And if you take a look at the picture over here that has the items on it, take a look. Where's that 1-inch border? You have all kinds of items sitting within that 1-inch border. So that's not a good sterile field at all. It's not a good setup. So we will set up a field, and then we'll also use those sterile techniques, and we will use urinary catheterization. So we'll use the same principles that we've used the sterile field with urinary catheterization. You do need an order for this. You can do it straight cath, or you can do it to drainage. Straight cath is something where you'll put in a tube into the bladder, drain it, and you'll pull it straight back out again. It's not something that you keep in. And I'll show you pictures of these in a minute. Straight catheterization is becoming much more popular in hospitals and long-term care and skilled care. Why? Because of urinary tract infections. This shows you an indwelling catheter, that we have a balloon, and the balloon is filled with water, and that's what holds the catheter, the Foley catheter, within the bladder. All right, here's the prostate and that sort of thing, but this is what holds it. There's no sutures or anything like that. This is what the whole catheter looks like, and this is what it looks like when it's hooked up to a leg bag, which you folks have seen already. On the left-hand side of this slide are indwelling catheters, because they all have balloons that have been inflated with fluid. On the right-hand side, those are straight caths. They're usually some type of vinyl or some other type of stuff that I'm not quite sure the names of it. But it's you can see where they have discrete holes in here that will help drain. Okay, and you can also see the holes over here. So they both do the same thing, but one stays in. You can see if one stays in, there's nothing to stop microorganisms from going right up the catheter. So you need really good catheter care. And on the right-hand side, it's your sterile technique when you put that in that makes a difference, that you're not introducing bacteria into the bladder itself. And we do our sizing by, it's called a French unit, or so if I say I want to put in a 16 French catheter, it's going to look about like this diameter, or 14 French. These are probably what you're going to see most often. You can go very small with small babies and that sort of thing, and I certainly wouldn't ever want to see anything this big, I'll tell you. In fact, I don't think I've ever seen anything that big. So, but I guess they do make them. So if somebody says to you, I need a 14 French, you know what it means. It's the diameter of the catheter in French units. Indications: urinary retention is either they cannot void, or they void and they don't empty their bladder. For very specific output monitoring, in that we need an absolute accurate output, so a catheter would be to use that. And again, for preoperative care, we're not seeing it as much anymore, because we don't want these. They can get an infection with them in, so you'll see less and less of them preoperatively. Hospital-acquired infections, going back to way back in the beginning of the semester, we talked about UTIs, or urinary tract infections, account for 40% of HAIs annually, with fully 80% attributed to the indwelling catheter. So you can see why we're getting rid of them. It's considered high cost, high volume, and folks like Medicare do not want to reimburse for these things, because they believe, and it is true, these infections can be prevented through application of accepted evidence-based prevention guidelines, and that is called good care of the catheter, sterile technique putting them in, and appropriate care. All right, so this is all within nursing's purview, and that's why this is so important. Let's see. So finally, sterility takes time. You must be conscientious and honest with yourself, and be aware that we make mistakes, and that's why we're doing this in the lab. And you know what? We aren't perfect, but as long as you identify it, you know what you're doing, and you can say, I have broken, I need to start again, or I need to get something else. We much rather hear you say that than say, is it sterile? You know what to do then. So, and a tip for beginning nurses, always bring an extra pair of sterile gloves or some supplies, because sure enough, you're going to get in there and you're going to drop something, you're going to need something. So bring a little more if you can. And prior to coming to the lab, you're going to be giving some gloves to take home. And I want you, as you watch performing sterile gloving, I want you to follow along and practice putting the gloves on at home. You can stop and start the video and do this. And do this a few times until you get comfortable putting sterile gloves on correctly. And I want you to come to lab being semi-proficient doing this, because we'll not be covering this in the lab. You'll need to know this before you start, because what we will be doing is going straight into setting up sterile fields, getting some solution on there, and actually catheterizing your patients. So please come prepared. It's a busy lab, and Joy, this is your final skill evaluation, which we will have for the evaluation. You will have to catheterize a patient using sterile technique, and this is your last lab. So if you have any questions, by all means, contact me through email or whatever. And remember, keep calm and don't contaminate the sterile field. Thank you very much.